Thank you, Joel. Good morning, everyone. I guess you're wondering, why should I even care about this topic? So in the next 9 minutes, Joel said, please stay on time, so I'll do my best, Joel. I will try and convince you that this is an important topic for all of you, as well as to provide a context for thinking about social determinants of health. And the best way to do that is by presenting to you a patient. I have no relevant financial relationships to disclose. However, my patient does exist. She's a 70-year-old retired public school teacher who presents with advanced glaucoma. We've all seen patients like this come into our offices, and we struggle with how can I really make sure that this patient preserves her vision in that right eye over the next 20 years. Her pressures are 19 and 25, and certainly she has optic nerves that really keeps us up at night, and visual fields over the last 3 years in her better eye that really are quite concerning. And so as you think about this patient, you might say, well, maybe I'll do a MIG, or maybe I'll do a trabeculectomy. But what about stepping back and really thinking about the patient in a holistic way, if you will? So why should I care about this topic? Because I'm sure you care about this patient. And how can we all address these disparities that we see in our country today? So this is a lot of data, but it represents a very important study by Chris Murray that was published in 2005 that actually examined epidemiologically the entire United States. And Chris came up with this idea that we really do have 8 Americas. There are populations across this United States that have different life expectancies, as much as 14 years life expectancy, from the healthiest to the least healthy. So within our own country, one of the richest countries in the world, we have the reflection of the entire world, from developing countries to the most industrialized. Again, another busy plot, but as you can see, this is from the CDC. And this is a plot that actually looks at the income, how income disparity actually influences health. And so we have West Virginia and Kentucky at the very bottom, where you have a very rich population and a very poor population. But near the top, you have Utah and Connecticut, where the income is a little bit more evenly distributed. The number of healthy days, then, is the way that these states are actually categorized. And you can see Hawaii is really near the top, where we have such beautiful weather here. It's actually the 4th listed. So the bottom line here is that the economy of our country really does matter. And certainly zip code may be more important than genetics in some disease states. We know in our own discipline, because our patients tell us, that their vision is quite important. What we really do have to do a better job of as a discipline, however, is ensuring that our colleagues know that too. Consider this fact, that 1 in 4 most significant contributors to loss of independence among older individuals is the loss of vision, and it also contributes to driving accidents and falls. This is the sort of data that policymakers will respond to, but for some reason we really have to do a better job of making sure that they know this because they don't know it at this point. So I hope you now understand why this topic is important. Let's see what we can do to address it as individuals. This is taken from Healthy People 2010. I had the pleasure of working with Dr. David Satcher, our 16th Surgeon General. When I left my role as a department chair, I became a dean of a small medical school where he was president. And this is just a nice framework for those of us who are visual people, really understanding this whole concept of the social determinants of health. In the center, we have the individual who comes into this world with some biology or their genetics, but that individual throughout life can actually make a difference in terms of their the influence of those genetics in terms of their mortality, in terms of what they choose or not to choose to do. Those social environments quite important. Certainly, if we pick the wrong social group, we can develop the poorer habits in life, and so that's certainly something important to recognize. Physical environment's very important as well. We've heard about food deserts in some parts of this country where it's very hard to get fresh produce. So, and policies and interventions make a difference, as well as access to medical care. So this is a framework to think about the social determinants of health, which are defined as follows: access to health care, poverty, education, work, leisure, and living conditions, all related to one zip code. So, genetics in general may account for only 20 to 25% of variation, and the different physical and social environments, another 20 to 25%. But human behavior, what we do, what we choose to do or not to do, including taking our glaucoma drops, really can make all the difference. So, returning to our patients, should we recommend laser, express shunt, canaloplasty, trabeculectomy with mitomycin C? You know, these are some of the questions that we may have, but certainly let's dig a little bit deeper, if you will. Does she understand really how severe her disease is? What about her social support? What about her insurance coverage? Other factors that may impact compliance. Well, we now know, after asking her those questions, she raised 3 daughters, she's recently widowed, she lives alone, she has some challenges affording her medications, and she has multiple comorbidities. So undoubtedly, she's on a whole lot of other medications. So what can we do as individuals as it relates to this particular patient? Well, let's understand the issues that she's dealing with. Let's understand some of the social implications. And for the younger ophthalmologists in the audience, these are some questions, some of these social questions that we really do need to have a better handle on. And so this could be some research opportunities in the future. We know that the choice of therapy matters in terms of economics. Jay Katz, who's here with us today, certainly has looked at this question, 5-year costs of 3 treatment strategies: medication, laser trabeculoplasty, and filtering surgery. And laser trabeculoplasty early on proved to be the most cost-effective therapeutic approach. These are sort of best practices and evidence that policymakers can respond to. We know how poor adherence is. We live it every day, where after a year, less than a half of our patients are on their medications. So returning to our patient, she really didn't understand the importance of using her drops, and she admitted to missing drops. She lives alone, relies on public transportation. She wasn't aware that she could actually get her medications by mail. And so what was done, we engaged her daughter in assisting her in getting her medications by mail, educated her daughter about glaucoma and the importance of the medications, explored her insurance status, and prescribed affordable medication, and had her undergo laser trabeculoplasty. So this is intended to be a summary of social determinants of health with this visual. Why should I care? Because understanding the social determinants of health matters. What can make the difference in the quality of care and how we deliver that care? Because that's what we're going to actually be reimbursed on in terms of the new healthcare reform. How can we address health disparities? Think and act beyond the technical considerations of care and personalize treatment based on the ocular and non-ocular needs of the patient. Thank you very much.